Assalamu alaikum wa rahmatullahi ta'ala wa barakatuh. Dr. Muhammad Sani Menege is my name. I'm a consultant otolaryngologist, head and neck surgeon, and epidemiologist. We presented a series of thorough lectures on COVID-19 disease, and we've received concerns from healthcare workers about some few details. So we want to talk about current recommendation about sample collection. Like we know, sample collection is very critical in this patient. Healthcare workers who are negative can actually get contracted to the virus, and they can also get infected by handling the specimen. So collection of specimen tests for severe acute respiratory syndrome coronavirus 2 is for now from the upper respiratory tract. So it's either in form of nasopharyngeal swab or oropharyngeal swab, and this is the preferred method of diagnosis. So other ways that have been used is to actually induce sputum from this patient, but this is it's not recommended because it's an aerosol generating procedure. Bronchoscopy has been tried in a number of ways when you can't get anything from the nasopharyngeal swab and nothing from the sputum, and patients not producing sputum. So bronchoscopy has been tried, but however, because it's also an aerosol generating procedure, there's a potential to transmit the infection to other people. So in view of this, it's actually preferable to limit it or to perform it when it's absolutely necessary, or it can be reserved for when we want to use it to clear mucous plug or secretions from intubated patients on ventilators. So we should also put in mind that all respiratory specimen collected for this procedure should be done in a negative environment. An additional specimen for considering all alternative diagnoses like blood, stool, and urine samples can be collected, especially when the diagnosis is not very clear. So the current recommendation for diagnostic modality of COVID-19 disease is actually a real-time PCR, which means polymerase chain reaction of the swab that is taken, or blood or some specimen taken from the patient. So that is the diagnostic criteria that SARS-CoV-2 is being used to diagnose. The results are generally available within hours to 2 days, depending on the country and the specificity of the test modality. A single positive test should actually be confirmed by a second RT-PCR assay targeting a different SARS-CoV-2 gene. This is to increase the accuracy of the test. If initial test is negative and there are still suspicions of COVID-19 disease based on the clinical symptoms, WHO recommends your sampling and testing from multiple respiratory tracts. So I'm going to broaden it in addition to nasopharyngeal and oropharyngeal, now taking it from other respiratory sites. For safety reasons, specimen from a patient with suspected or documented COVID-19 should not be submitted for viral culture. So viral culture should not be contemplated, should not be attempted on this specimen. And samples should be tested for other viral or bacterial pathogens, especially this COVID-19 could have some differential diagnosis from other pathogens when the symptoms are not classical. So currently, rapid tests that can be used includes COVID-19 IgM and IgG antibodies, which are also important in detecting SARS-CoV-2 in human whole blood and serum and plasma sample. This is quite critical, especially as Nigeria, as a country where these tests, and other developing countries, these test kits are not available. So these are some few tests that can add some value in trying to screen people. Thank you very much for your time. Assalamu alaikum.